Hello student, today we are going to discuss a very important topic, but what is infection and explain briefly. This is very important questions. Okay, now infection, the alteration in normal biological function of tissue or cell due to any foreign particle or pathogen. So this is known as infection. For example, boils and folliculitis. Okay, types of infection: primary infection and secondary infection. Mostly these are very common. Primary infection, exposure to a pathogen for the first time, is called primary infection. For example, boils and folliculitis. Secondary infection now. In secondary infection, a new infection occurs when host resistance is lowered by pre-existing infectious disease. For example, a vaginal yeast infection. Okay. Now, nosocomial infection. What is nosocomial infection? It is hospital acquired infection. When you go to the hospital, then you are going to affected by any patients like that. So this is known as your hospital infection or known as nosocomial infection. Okay. Now, surgical site infection. For example, if you are going for a surgery and then if you are going to have a surgery and maybe you got infected because of some surgical site, maybe some other instruments which are infected, they touch your body like that. So surgical site infection it can be also. So in like catheter associated urine tract infection, for example, like catheter was infected and now your urinary tract infection also because of that. Now, focal infection. What is focal? Infection to a localized site. For example, gonorrhea and tetanus. So it is an infection on a localized site. Okay, in a particular site like gonorrhea and tetanus. Now, iatrogenic infection is an infection caused by surgeon's activity like carelessness. For example, if you are going for a left leg surgery and your surgeon is going to do a right leg surgery, then it is going to be a wrongness. It is going to be like infection in your right leg because the surgery was about left leg and the surgeon just did right leg. So that's why it's a wrong kidney was removed, for example. Okay, so it's a wrong infection or it's a wrong way of doing surgeries because it was a mistake of a surgeon. It was not your fault. So these type of infections which is based on wrongness of surgeons and doctors and physicians, then this infection is known as iatrogenic infection. I hope you understand. Make sure to write down, practice, and subscribe and share to your all friends who are learning. Okay.